Welcome back to the episode of Going Direct. Thank you for joining us today. I know that you were just presenting to our new officer training. And so I kind of was hoping that for those who haven't listened to the first episode of Ready Rebound, if you could just give us a brief overview of who Ready Rebound is and what you do.
Great. Yeah, no, first off, thanks for having me today. Super glad to be here meeting with everybody. So Ready Rebound really is about applying that sports medicine methodology to healthcare recovery for public safety. So when you're injured on duty, off duty, your family, retirees, if you have an orthopedic type injury, we're here to help expedite that process and get you expedite access to quality care, sports medicine doctors that are going to help get you through that process, get you back to life, and get you back to work quicker.
Awesome.
Yeah.
And for people who are just watching or tuning in, our first episode, we do dive into kind of the history of our partnership with Ready Rebound, how you guys came to be. So I'll link that episode as well so people can kind of get more of a background.
Great.
But today we're just going to go over some Q&A, some quick FAQs that we've gotten, that you've gotten.
Right.
And so let's start with, you mentioned orthopedic injuries. One question we get is, do you cover mental health or cancer or any other injuries besides orthopedic?
Yeah, so right now our primary focus is on orthopedic injuries. So I tell people is if you can break it, pull it, rip it, tear it, strain it, all those things, we can help, including hernias and concussions. We do know that there's a big need for mental health support, cardiac and oncology. We are exploring, we have 5 different test markets right now in the nation for cardiac and oncology. Okay. We're starting to look at build some of that in Southern California. So while we're not there yet, we are working that direction, and we are also starting to have those conversations internally about the mental health piece, right? And making sure that we can, is this something where we can find clinicians that are, one, culturally competent, that understand what firefighters and police officers go through to make sure that they're the right fit for you, but also understand how to work within the work comp system. So we're having those conversations right now. We know it's a need, and that's the direction we're heading as well.
For sure. And this is a partnership with the department. It's a 2-year pilot program.
Correct.
So one of the questions we get is, who pays?
Great question. So right now it is being paid for by the department. The department has made the investment. It is a flat fee that they pay. It's already been prepaid essentially month over month. And so it doesn't matter how much or how little the service gets used, the fee doesn't change. So if everybody in the department were to call us tomorrow, it doesn't impact that fee. So it is being paid for by the state for the benefit of the employees.
And then after the 2-year mark, what's the option for? Is it like a renewal? Like what's the process like for that? Right.
So we are it's a 2-year agreement right now with an option for a 3rd year. It is a pilot program right now, and that's what we're working on. So if they see value as we go into this 3rd year, we can have the option to renew for a 3rd year, and then we'll look at how do we make sure that this becomes a more long-term partnership.
Cool.
So and getting people to actually be aware of the service and utilizing the service is where we show the value back to the state leadership.
Yeah, no, for sure. And kind of going off that too, it's not just for our members or firefighters, it is for family members.
Correct.
And how does Ready Rebound define family member?
Yeah, so we know everybody's family looks a little bit different. So obviously, your parents, your children, that types of things. But we look at it as if they're family to you, we want to make sure that we're taking care of them as well.
Yeah.
Yeah.
For sure. Okay, so if someone gets injured, at what point from injury to calling Ready Rebound? Is there a time frame they have to call, or is it open-ended? And second part to that, if an attorney is already involved, is it too late?
No. So that's both great questions. So, we always encourage people, for CAL FIRE employees, for those on-duty injuries, you have to, once you get injured, you have to fill out your paperwork with an IAPS. You have to notify your supervisor. Once that's done, that's when we really encourage people to call us, right? There's no time limit or requirement that they have to call us. It is an optional service. But the sooner they call us, the better we can start supporting them right out of the gate. Because we start working immediately with their adjuster at State Fund to figure out what those next steps are so we can help advocate for them and help get things moving along quicker. So the sooner they call us, the better. But it doesn't matter where you're at in that care journey. If you're 5 years in, 10 years, to us it doesn't matter. If you're hurt and we can help support you, we're going to look for what we can do. So I encourage people, if you're going through something today or if you get hurt tomorrow, call us as soon as possible, as soon as you learn about this, and let us help you get through that process.
Yeah. How do you guys work with, because the department's obviously paying for your services, but then how do you work with insurances? And what does that process look like? If they already have a provider, how do you work within the medical system?
Right. So it's partly dictated by what type of insurance they have. So PPOs, HMOs, all those different types of things. So we look at that. One of the things we're going to ask during intake is, who do you have for your primary insurance? And we're going to make sure that we give you options of providers that were within that network, right?
Yeah.
We're going to connect you with those folks. You still get your bill from the doctor's office. You still do all of those normal things. But we're going to look for, we have providers in each network, so we're going to look for providers that we can partner with you to expedite access to that appointment, so you're not having to wait, weeks or months for an appointment, so we can get you in within a matter of days instead. So we can work with the provider. You still have to work with your insurance company, but once they approve whatever the treatment is, then we can help get those things scheduled right away.
Cool. And you mentioned, so if it's on duty and you're going the workers' comp route, but you also help off-duty injury too.
Correct.
And do you notify the department if that happens, or HR? I know that's a concern.
Great question.
Yeah.
We follow HIPAA laws strictly. So if you go out this weekend and you fall off a skateboard or whatever it is, call us. We can help you. We don't communicate any of that information to your department. It's on you to tell your supervisor, hey, I can't come to work, or whatever the issue is. But we do not share any of that information with your department at all. It's HIPAA laws strictly.
Awesome. Very cool. How much, or what is the time frame are you seeing members, or, because you're across the country and with many different departments and first responders in general, what is the turnaround for someone who calls you and gets the support and services they need and gets back to work faster than if they didn't call you?
Great question. Yeah, so typically, on average, we see about a 30% faster return to work, right? Back to full duty.
Yeah.
Nationally, to get into an orthopedic specialist for imaging or even physical therapy, it's going to take at least 14 days on average to get into those appointments. And surgery typically takes about 60 days.
Yeah.
Specifically for the members of CAL FIRE that have used our service, we're seeing about 3 days or so to getting into those imaging appointments. We're seeing orthopedic specialists within about 5 days. And for those surgical cases, from authorization to surgery, on average, we're about 26 days. That also takes into account where members are not able to get into those appointments as soon as we can facilitate it, right? So a lot of times they have childcare issues, they have something pre-planned, and they just can't make that appointment work. So when we back those factors out, those delays coming from the members, we see about 16 days from authorization to surgery. So we can get people in quite a bit quicker than what they've probably experienced in the past.
Okay. Yeah. Very cool. Let's see. Do you have any, because I know some of our members have called Ready Rebound in the past, and I've actually spoken to some, and you were at our convention. Do you have any success stories that you can share with us of members that have successfully used your product or services? I guess?
Service, yes. So first off, last quarter's magazine had a couple of great articles in there with success stories. So, some of the ones I've seen is where the member calls us and with a shoulder injury, and within 12 days we got him in for surgery. Right? We went through the authorizations. We got him, help facilitate that. We helped get all the pre-op stuff in place and just really moved everything along. So, they injured their shoulder, torn shoulder, and within 12 days they're having surgery and they're already getting back to work. And why that's important is with those orthopedic type injuries, the sooner you get it diagnosed and treated, the better off your recovery is going to be. So we want to try to move those things along. But yeah, there's definitely a lot of stories out there, and I would encourage people to, if they have had this, to use the service of Ready Rebound, have gone through it, share that information with your friends, right? I can sit here all day long and tell you how great it is,
right.
But until you guys hear it from each other,
firsthand,
that's where it's really going to resonate. So if you've used the service, I encourage you to share that information with your coworkers and your friends.
Do you guys do follow up, like after the process is complete? Yay, we went through all of it, got my surgery, I'm back to work. Do you have do you follow up with them every so often, or like for a couple months just to check in? What's that look like kind of after you're done using the service?
Yeah, that's great. Well, first off, as you go through the service, your navigator is going to be reaching out to you at least once a week just to see how things are going, what's happening. But also after every single doctor's appointment, within about an hour and a half, they're going to call you and find out what's next, how to go, and get some details from you so we can communicate that to your adjuster. That helps move things along.
Yeah.
Beyond that, once you have hit that, you've gone back to work, you're through the recovery process, we're going to reach out to you at weeks 4 and week 8 just to see how things are going, make sure everything is still on track. The other thing that is important is helpful is we will also send out a survey to you once you've gone through the service, and we want to hear your feedback for a couple of reasons. One is we want to make sure we're always improving the quality of our service, but we want to hear from you so we can also share that information with leadership of the department to show the value that it's bringing. I know the department really values the member experience. Yeah. That is a big reason why we're here, because they've heard and they've seen some of the frustrations, and they're trying to solve for that. And so, us being able to share your feedback with them is critical, right? The good stuff, the bad stuff, all that, because we want to improve the service as well.
Yeah. Hopefully this doesn't happen, but if someone got injured twice, is there a limit to how many times they can use Ready Rebound?
There's not. So there's no limit. You can call us as much or as little as you need. Hopefully you don't have to have it multiple times, right? But some of us, we end up in that boat, unfortunately. But yeah, we've had some that have called us multiple times, and we're always there to help support them.
Okay.
Yeah.
Do you have any, do you get any commonly asked questions that you want to share, or any remaining feedback or information that would be helpful for our members?
Yeah, no, great. I think I'll actually go back to one you brought up earlier. I don't think I answered the second half of it. Is what if an attorney is on the case, right? So if you have an attorney already in the state of California, you cannot speak directly to your adjuster anymore. You have you work through your attorney, and they're there to help protect you, and we want to make sure we're doing that. There's nothing that precludes you from working with us and us talking to your adjuster. We will just, if we find out that you have an attorney, you let us know. We will communicate with your attorney, let them know who we are, what the services we're providing, and make sure that they're on board with us, continue to help advocate and support you through that journey, which most of the attorneys have been throughout the whole process. So we work really well with them.
Nice.
Yeah. So we just make sure we communicate that with them.
I know for our members who don't know, you came to our new officer training. Hopefully that becomes a yearly. We have the course every year. Hopefully you're able to speak each year. You're coming back again in May for our membership 101/family liaison training. So we're really trying to push and promote this amazing service and really get it out there. And for any chapter directors or DVPs out there, you're willing to come to meetings and talk to members directly.
Yeah. So if you want some more training within the units or within the chapters, reach out to me. I can make sure that my contact information is available. More than happy to come out, whether it's in person or virtually. The other thing I want to touch on is also make sure that people know, especially as we're going to the warmer months in the springtime, and our kids start playing sports, right?
Yeah.
This also covers your family, like we talked about, your family members. And so in a nation, I'll say, where healthcare can be challenging in general, as a parent, it feels really good to be able to provide this level of care and quality of service to your children. So if your children are out playing sports and they get injured, reach out to us. Let us help you get through that process and make sure your child gets the best care possible. Yeah. And again, that piece doesn't cost you anything, right? We extend that as a courtesy to everybody else because the department's already made that investment for those on-duty and off-duty injuries. We want to make sure, as your family as well as the retirees have access to that benefit as well. Moving forward. So let us help you get through that. You'll never get a bill from us, right?
Right.
You'll get your bill from your provider,
right?
But not from us. We're here to help advocate and help you get through that process.
Because you're essentially like the liaison to navigate the system, just to help push it forward and move it forward. But you are still billed through your insurance by your provider, just not your services to help completely covered.
Correct. It's already been paid for by the department. Yeah. For sure.
That's awesome.
Yeah,
very cool. Great. I know Chief Tyler at our convention did a shout out to you guys as well during his speech. So I know it's important to the department as well. So it's pretty awesome.
We had a lot of support from the department. Obviously, they brought us in. They spent a lot of time working on this to get the program brought in. So now at this point, we're really just trying to help educate and make members aware of the service. So when they do get injured, if they do get injured, that they're reaching out to us right away, letting us help them get through that process. So that way leadership can see, that people are utilizing this great benefit. It's not something that we've had here in California before. We've only been in California for about 2 years. Been in other states for about 10 years or so, but California does have some of its own unique challenges. And so we want to make sure we were fully prepared, and we work closely with the state, with State Fund, with the department, and all the providers to make sure that the members have the best experience possible.
Yeah, that's awesome.